National University is an access, success, and equity innovator in the world of higher education. What that means is that we serve student populations that are a little different than most other folks in the world of higher ed.
We're a veteran-founded university, and we serve a really unique demographic of students. We're exceptionally diverse and serve older age students.
Traditionally speaking, they would be called non-traditional, but they're actually more traditional now than we think.
We complement a lot of what exists out there, but we also like to think of ourselves as different in that we are all about expanding access and accessibility for the working adult in higher education.
We offer both on-site and online classes, and that's really important to us because we want to be able to meet our students where they're at.
We serve people who are in the military, we serve people who are working, we serve parents, people who are in different kinds of pathways than your traditional 18 to 20-year-old that's kind of starting their higher education journey.
It's not just about getting them through the door, getting them to their degree goal. It is about the student as a whole person.
You can't treat them as only students. You have to treat them as all of their ands.
Anders are students who are parents and students. They are soldiers and students. They are employees and students. So they're never solely a student. So we have to be able to wrap the kind of education we have around their quite complicated lives and help them learn well and finish strong on that higher education pathway.
The stress that students are under today is profoundly different than a decade ago.
When they're juggling all the balls and the balls start to drop, usually one of the first balls that drops is their classwork.
There are about 38 million people in this country with some college and no credential. It means they tried higher ed and did not succeed. The vast majority of them left higher ed not because they weren't academically capable. Most of them left because life happened.
National University is primarily online. Our students are online because they want the ease of being able to complete programs at a fast pace.
Not only do we have students across state lines, but we also have students who are incredibly mobile.
TimelyCare is fluid because it's not taking them out of their current environment that they're thriving in. It keeps them in that environment so they can easily shift from being a student to needing that mental health support.
Having something like TimelyCare where we know a student can get licensed care in their state is huge and takes a huge burden off of the student wellness team.
Prior to this, we were only ever able to provide asynchronous services, self-help resources, referrals in communities, and many of our students came to us asking, I want to speak to a therapist. I need this service now.
I chose to start using TimelyCare because I really needed an outlet, because at the time I almost had to wait 3 months before I could see my behavioral therapist, and TimelyCare really filled that gap.
Being able to access TimelyCare from most any time of day and really most any location from my phone just gives me one more reason to do it.
I use the TimelyCare a lot at work because, I work in a facility that, is highly stressful. Sometimes I do get overwhelmed. I take my time away from work to do that and then come back and reset.
The most impactful service for students has been the scheduled counseling feature, the ability to have regular sessions with the same provider week after week or month after month, whatever they select.
Coming from the Marine Corps, that took a toll on me. I was actually on a pretty bad streak with my classes, but the provider I've been working with so far, she's given me more tools to work with. I feel a little bit better about how I can handle moments where I'm not feeling like myself, not feeling motivated enough.
TimelyCare definitely opens doors when it comes to students who may be hesitant about engaging with mental health services.
You are able to visit a provider in the comfort of your own home. You can select therapists based on demographics, based on preferences that you may have.
Just from viewing the list of providers, I can see what their specialties are.
This guy seemed like the right match, and when we got to talking, it felt like the right match.
TimelyCare has definitely removed barriers that our students are experiencing when it comes to accessing care. They no longer have to worry about, is a provider in network? Are they out of network? How much is this going to cost me each session?
If TimelyCare wasn't available, I'd probably be sitting behind my desk just sulking, kind of wondering, like, what's the point?
I've talked to many students and heard directly from them that without TimelyCare, they wouldn't have done anything.
Or they would sit on a wait list, or they would sit in an office with a single provider who may or may not be a good fit for them.
TimelyCare has really helped me as far as kind of building my confidence when it comes to communicating and kind of believing in myself. There's no harm in asking for help.
I'll be graduating, and I didn't know I could get to this point without TimelyCare and the wellness team.
TimelyCare is one of those things that we can add to the family of smart strategies that will help our students early and help them stay on track and hopefully walk across that stage with a big smile and on the Jumbotron with their name being announced. Those are the moments you're working for.